We want to talk to you a little bit today about the healthcare exchange and the ways that we believe it's going to help us to bring in federal dollars to help Vermonters, both companies and individuals, pay for health insurance with costs that are rising so fast that it's killing them. It's stopping job growth, it's stopping economic development, it's forcing hardworking Vermonters to spend more and more of their dollars on health insurance instead of on other investments that they need to make to live. As many of you know, the bill that's moving through the legislature right now, and I'm incredibly grateful to the legislative leadership and to the hard-working chairs and members of the legislature for moving it so quickly, has a number of benefits for Vermont, the exchange, that I don't believe have been as well articulated as they could have been. So let me just briefly walk through how I think this bill is going to be so helpful to Vermonters who are struggling to pay for health insurance. The healthcare exchange will bring in $200 million of federal money in the form of tax credits to Vermonters who are currently struggling to pay for health insurance, or to their employers who are struggling to pay for health insurance. It'll also bring in an additional $100 million, we estimate, in additional Medicaid payments to help Vermonters pay for health insurance. So a total of between $300 to $350 million of federal money that we don't have today if we can get enough Vermonters into the healthcare exchange. It also brings administrative simplification. You're going to be able to go to the exchange, see the various options available to you either as a business who's shopping for insurance or an individual who's shopping for insurance, and the plans will be right there in front of you, everything that's offered in the state of Vermont on the screen for your simplification purposes. So the obvious question is, who benefits? The people who will benefit from employees and employers of 50 or less being in the exchange are about 96,000 potential Vermonters. In other words, currently we have 16,000 small businesses in Vermont with 50 employees or less. 16,000 small businesses in Vermont could benefit from this bill who currently have 50 employees or less. So we believe the exchange will be available to about 96,000 Vermonters, and if you make $45,000 or less a year as a single individual in this state, or $92,000 or less for a family of four, this bill could benefit you. What the exchange will do is bring in hundreds of millions of dollars of federal funds to help individuals pay for insurance. Now, how does it actually work? We believe that there are many instances where employers may choose to get out of the health insurance business for their employees and instead have individuals who are working for their companies get the federal subsidies and come out ahead by buying direct on the exchange. I have long advocated that one of the biggest obstacles to job growth in Vermont is the inability for employers to afford the rising cost of health insurance. It stifles job growth, it stifles investment, it stifles raises given to employees. It is killing business, the rising cost of health care. This exchange makes it possible for employees to get out of the health care business and let this exchange will allow employers to get out of the health care business and allow their employees to get federal subsidies by buying directly in the exchange. So those are some of the benefits. I want to turn it over very briefly to our chair of the Healthcare Committee, Representative Mike Fisher, who's been working very hard on this bill. And then I want you to hear from a business person in Vermont who we believe is an example of those who might benefit from the exchange. So thank you, Representative Fisher. Take it away.
With you here. Thank you. It's good to be here. I am proud to have an opportunity to report H559 on the House floor tomorrow. The H559, in combination with the underlying federal Health Affordable Care Act, will provide a set of benefits to Vermonters that I'm proud to be a part of advancing. Under the new world of healthcare, we're going to be able to free Vermont businesses from the burden of having to worry about the employee benefits of their employees. This freedom is going to allow them to focus on what they do best. These small businesses can focus on growing their businesses, growing jobs, providing good services and good products to Vermonters. This is an important step forward. The bill also provides a new protection for individuals, either employed individuals or individuals who are buying insurance on their own, to get the kind of coverage they know they need to take care of their health care problems and to be able to afford that coverage. The bill also takes a population of Vermonters for whom we currently pay providers too little for their care and moves them into a market reimbursement for the care that they need. This is a reduction in the cost shift, and it's a good step forward. So I'm proud to be a part of this effort, and I'm looking forward to the debate on the floor, and thank you for having me.
Thank you, Mr. Chair. I'm delighted to have with us Michael Roach. He's the owner of Stowe Tree Service, Stowe Tree Experts, and he's a great example of a small business, 5 employees, who has struggled to pay for health insurance and has not been able to, in his words, adequately provide affordable health insurance to his employees. So, Mike, thanks so much for joining us, and come on up. Good to have you in Montpelier.
Thank you. It's nice to be here. Thank you, folks. As the governor mentioned, I'm Michael Roche. I'm the president of Stowe Tree Experts, and I do have 5 employees, including myself. I have a small accident insurance plan for my staff, but it's not adequate. I simply cannot charge enough for my services in order to provide health insurance. So I truly appreciate the efforts of the governor and the legislators, because I feel that their efforts will have a direct positive impact on my employees. I feel like my company is the type of company that they are trying to help. I actually don't think the plan goes far enough or fast enough. It might be a little scary for some people to hear that, but I think the governor feels the same way. It does need to move along. We've had the debates for a long time, and it's been over 10 years now, and it's time to make decisive action. I feel like change can be hard, but the world is changing fast, and public policy needs to change too. Vermont has an opportunity to make intelligent choices and bring about a more efficient and affordable medical coverage. As an employer in the state of Vermont, I'm counting on them to bring intelligent change to our system. Thanks.
Thanks, Mike. Appreciate it. Sure. Mr. Speaker, thanks for joining us.
So this bill is about helping middle-class Vermonters and is about giving businesses the freedom to concentrate on what they do best, and that is run their business, not run a benefit program. That's what this bill is about. I'm proud to have worked with the administration to implement the aspects of the Affordable Care Act and the Health Benefit Exchange. And I think what we're going to find is that there's been much ado about not much here. I think people are going to realize that more individuals are able to get health care coverage. More individuals are going to be able to afford health care coverage, middle-class Vermonters. And we're going to have businesses running their business instead of running a benefit program. I look forward to the debate over the next 2 days. I expect it to be a robust and lengthy debate, and I think that through that debate, people will understand the benefit that this program will provide to middle-class Vermonters.
Thank you. We would be happy to answer any questions.
I guess the big question is, if the exchange is going to do so many great things, why not just make it voluntary?
Well, let's just back up a minute. As Michael just suggested, from his perspective as an employer, the exchange is not the answer to all of our problems. It's a small step in ensuring that we draw down federal dollars, $350 million, as the speaker just mentioned, to middle-class Vermonters who are struggling to pay their bills. The Green Mountain Healthcare Board is designing the first sensible cost containment system in the country. That's where we need to get. Why require all people with 50 employees or less to get in? Because if you're not in the exchange, you can't get the federal benefit. And we think the federal benefit is hugely helpful to us. We also believe that divorcing employers from the responsibility of having to run a benefit package, as the speaker just mentioned, is the right thing for Vermont businesses so they can focus on what they do, which is create products and create jobs.
But that doesn't really answer the question. That is, if it's such a great deal, if I'm a business owner and I see all the money that's available and I think this is a way that I want to go, if it's voluntary, I'm going to jump right in. So why mandate it in that case?
There's no reason not to mandate it. This is a great program that's going to bring in federal dollars that we desperately need to help us pay for health insurance in this state, and we believe that it is in Vermont's best interest to have as many Vermonters in the exchange as we possibly can.
Is part of the reason that you want to separate benefits from businesses and have individuals get their own coverage? I mean, you were basically saying if you were a small business with less than 50 employees, you drop the coverage for those folks and let them go into the exchange and get the federal tax credits. Is that the bridge to single payer because you've divorced coverage from someone's place of employment?
Well, let's back up a minute. On its own, without any action on the single payer bill, this bill makes sense. It makes sense that every Vermonter, the small business, be in this exchange with 50 or fewer employees. The reason for that is simple. We are going to get them out of the burden of having to spend inordinate amounts of money and time managing health care benefits when we can have individuals doing that instead and getting federal subsidies to help pay the bill. So there's every reason why this is a step that makes progress for Vermonters in being able to afford health care and our job creators to be able to do what they do best, which is run their businesses. I can tell you as a small employer who's been running a business in this state for over 30 years, health care takes an inordinate amount of time for small business and sucks up precious resources that you would rather use to help grow your company. So there's every reason why this exchange is a step in the right direction for those who have 50 or less employees, and in 2 years for those who have 100 or less employees.
The opposition to what you've been trying to do keeps saying that it's going to force businesses to drop health care. What you're saying, you're trying to make that a virtue.
That's a virtue.
Let's have businesses drop health care, that'll be better.
That's correct. We believe that by getting employers out of the responsibility of having to provide health insurance for their employees, we're going to grow jobs, economic opportunities.
Aren't you worried a little bit that all these individuals now off on their own, not being covered by their company anymore, just won't bother to buy health care?
No, I don't think there are very many Vermonters who don't want to have health insurance. Most Vermonters that I talk to desperately want health insurance. They just can't afford it. And let's be honest about this. Those who work for most Vermont companies understand that every year they're being asked to pay more and more of the cost for less and less coverage. Employers will tell you that they're sending more and more money to for-profit insurance companies for less and less coverage for their employees. This is a bad situation. The exchange will help us get out of that situation. It's a step in the right direction for companies like Stowe Tree and others of allowing employees to be able to afford insurance with a federal subsidy and getting the businesses out of the business of having to be in the health insurance business.
How many employees does Putney Student Travel have?
Well, it varies between 18 and 20 full-time.
So you would be in this, I mean, your former company.
Well, I've just got to tell you, I'm on leave from Putney because I'm honored to have a different job.
This company that you know.
You'd have to talk to them about that.
This company that you knew pretty well would be able to use this and might be able to dump their health insurance.
I think that companies like mine would be wise to get into the exchange. They'll be required to do so, and to look at the benefits of getting out of the health insurance business for their employees by letting their employees get a federal subsidy and buying it direct. It's a win-win for the company, and it's a win-win for middle-class working Vermonters.
Do you know, is Putney planning to do that?
I don't know because I don't work there anymore, but I'd be happy to make a call.
If I had a business of 25 or 30 employees and I took your advice and I dropped the health care coverage, I'm going to save a lot of money as a business because in some cases I might be paying $5,000, $8,000, $10,000 per employee, right? What happens to that money? Do I get to keep it? Is there some responsibility that I should share some of it with the employees?
Well, I think the beauty of this exchange is that an employer understands what their employees make, they understand what they're paying now, and they understand the federal dollars that could be drawn down by that employee that's being replaced by money they're currently spending. We shouldn't see that as a negative thing. The more money that we can free up for businesses to invest in job creation, in innovation, in expanding their businesses, the better off we're going to be as an economy. So I would say that as a responsible employer, I would be certain to help my employees cover what this bill doesn't and get out of the health insurance business.
So isn't it true?
And by the
that-
way, most employers do that now. I just want to back up. I can tell you in my own company, we have now gone to health savings accounts, and we give our employees money to help fill the gap between the deductible, and most employers do that. You don't just say, hey, you're on your own, you have a $4,500 deductible. Usually you pay a large portion of the deductible and they put it in their accounts.
So isn't there a study, though, done by your administration, the Act 48 integration report, that says that a lot of businesses in the association market might actually see rate increases?
That isn't what our study says, and it's really important that this be understood. What the study says is that if you had everybody go into one pool like this, and those that are currently in association were to go into this pool without any federal subsidy, you would see rate increases. But because of the $350 million in federal subsidy, you're comparing apples and oranges. In 2010, that little piece of that long report says, if there were no federal subsidy, some might see a rate increase. But because of the federal subsidies, because businesses are going to be getting out of the healthcare business, and the federal government will be subsidizing individuals, you are comparing apples with oranges. There is no increase under the current bill in our estimation because of federal subsidies. Businesses are going to see a decrease, and so are individuals in cost. Listen, $350 million in the state of Vermont. That's a lot of money coming into the system that we don't have right now. Now, what's wrong with that? What's wrong with that is it does nothing to contain cost, which is what the Green Mountain Healthcare Board is working so hard to come up with a sensible system that not only reduces cost, but increases access. So this is a step in the right direction. It doesn't solve all of our problems.
So can you guarantee for businesses?
Come on over.
This is all.
We'll give you a seat at the table.
Is there a guarantee that this is going to be a cheaper proposition for businesses in the exchange world?
We believe that because of the federal subsidies that will be available to middle-class Vermonters, this will save businesses money and it will reduce costs for working Vermonters.
Governor, you explained what happens with Michael's company, but what happens if you are a 10-person law firm, graphics design firm, with people making above that income sensitivity level, and the boss says, okay, we no longer offer health care, you don't qualify for the subsidy, but you go into the exchange. What happens to those people?
Well, obviously, businesses can make that choice right now with or without an exchange. Nothing changes in the respect that any business person, law firm or otherwise, can decide not to offer health insurance in Vermont and in America. It's a free country. The point is, what the exchange provides is a place for individuals whose employers choose not to provide them insurance to purchase insurance, a logical plan, understandable, without having to give agents $20 million a year in fees. And there were also federal subsidies to help pay the bill if you're a middle-class Vermonter.
But if it's an architectural firm and the principals are making $150,000, $90,000 to $150,000,
Well, obviously,
those employees are then going to be faced with a huge health care bill that they did not have before. It was being paid, through the current.
only if the business chooses not to offer health insurance. That would be true today with or without the exchange. The exchange doesn't change that.
What's the penalty for a company with fewer than 50 employees says, I don't like this whole idea, I'm just not doing it? What's the penalty?
I better turn that over to you. There is no penalty.
So it would just...
What do you mean? I mean, you have to buy insurance in exchange, but if you choose not to, what happens?
Under federal law, there are no penalties for businesses that are smaller than 50 for choosing not to offer, for not offering insurance. No penalties.
But for the larger businesses, there is a penalty, right?
For larger businesses, there is typically complicated federal law about how the penalties will play out.
Isn't it true that tech subsidies aren't available to Vermont's local plans?
Are not available?
Are not available?
Most of the subsidies in this plan are linked to silver plans. That's correct.
But by including the bronze level, you create this option that could be attractive to a lot of people that isn't going to drop down any of these subsidies. So why would you do that? It seems more counter to the goal.
We want the exchange to offer the same products that you could buy on the open insurance market today, period. We want to have as wide a variety of options as the exchange is supposed to be a single source for health insurance information. We also understand, and we'll make very clear in the exchange, that if you have an exorbitantly high deductible, you're not going to qualify for any federal tax credits. And that seems like a fair way to approach it.
Can you give some idea of how much of the total package nut the subsidy would cover? I know it's going to be different for various incomes, but let's say my employer tells me, you're in the exchange now, you can get the subsidy. Will the subsidy cover 100%, 50%?
It depends upon your income, how much money you make.
Best case, worst case?
The lower your income, the more it's going to cover. The higher your income, the less it's going to cover, up to $92,000, $96,000.
But no idea what the percentage would be?
Well,
Or
we can get you those numbers, but for an individual, as you know, the limit is $45,000, $44,630 to be exact. And obviously, the higher you are on the income level, the lower the percentage subsidy. The lower you are in the income level, the higher percentage can be as high as 70, 80. Steve, what does it get up to? 70%? You can get up to 90% if your income is low enough. But there's a scale, and Steve Kimball, Commissioner Kimball, can give you those numbers.
I just had a quick question for Mr. Roach, is that right?
Yeah. Michael?
You've got 5 employees.
Yes.
The governor is saying if this bill passes, maybe the best thing for you to do is to not offer your employees any health insurance and they can go into the exchange as individuals. Is that the decision that you would make?
It sounds like at least it's a good option. You know, right now, we don't have any affordable option. We don't have an option because it would come down on me. And this just sounds like it's a better option for my employees to have.
Right now, you said you have accident insurance, but you don't have standard health insurance.
Yeah.
So if somebody gets sick and has to go to the hospital,
That's right.
They're not covered.
Yeah, that just happened to me.
And so your situation then would be, your employees would now be among this group the governor describes of people who are not covered by their employer, already the case with your people, but they would be eligible for these subsidies presumably to go out and buy health insurance through the exchange.
Yeah, I think that's a great idea. I think it's a great option. And it sounds like I have the opportunity to help pay for some of that. Is that correct? I can help pay for some of that exchange.
Yeah.
Okay, so at least that's an improved option as well.
By raising their income.
Is that $200 million figure based on just the 96,000 people that would be captured in the version of the law? Or does that assume that IBM, all the businesses between 50 and 100 also are
No.
sending their people in?
We estimate that Vermont could benefit from up to $200 million in direct subsidies to individuals in companies of 50 or less. That's the $200 million number.
So why stop at 50 or less? Why? Originally you wanted 100 or less. That would seem to be a more dynamic number.
You know, as you know, in 2 years, companies who have 100 or fewer employees will be required to be in the exchange. We didn't think that it was a battle worth fighting for 24 months. The federal government's going to ensure that our exchange continues to grow as we bring more companies in. We think it's good to start with 50 or less. We'll get it right, and we expect that if you look at, I think this is going to be a huge benefit for smaller companies in Vermont. And my guess is that some companies who have 100 or fewer, between 50 and 100 employees, may well wish that they could get into the exchange earlier, but we'll have to see.
At this first step, what do you project this is going to do to the percentage of insured in the state?
Well, I don't think we have good numbers on that yet. this is what I know. Vermont has about 45,000, 50,000 uninsured Vermonters, and Michael just talked to you about some of them. We also have about 150,000 Vermonters who are underinsured, who know that if they get really sick, that their financial security is on the line. Huge, terrible choices. I'm really concerned about those 150,000 Vermonters. That's a lot of Vermonters. We only have 625,000. You put those two numbers together, that's a third of our state. So this exchange is going to help employers grow jobs by getting them out of the obligation of having to provide health insurance to their employees, and it's going to give Vermonters who are underinsured the resources they need to be fully insured. And that's a great development for Vermont.
Why is it taking 6 weeks to get to the point where, okay, everybody, this is the reason why I'm doing this?
Well, some of us are slow learners.
Well, the Republicans are going to come out right after you're done here and say there's still too much confusion. Paul Poirier acknowledged the other day he doesn't get it. Is that why you're doing this? Or?
No. Listen, let's remember that every state in the country is going to have a health care exchange. As a governor, I have two choices. We can go through the process we're going through, transparent, open discussion, and develop our own exchange, or we can have the federal government develop it for us. Those are the two choices. There is not a third option under federal law. I think this is a huge opportunity for Vermont to make a step forward in growing jobs and getting affordable health insurance to Vermonters. But obviously, this is a conversation when you have change, you're going to have people for it and against it. I think this is a great discussion. It's hard for me to conceive of a good reason, unless you're working for an insurance company broker who's going to lose some money. It's hard for me to conceive of a reason why you wouldn't make this smart step forward for Vermont.
Governor, one logistical question. Let's, and I'm not sure exactly how this plays out, but let's say in 2014, everybody thinks this is a great idea. All the employers agree. They dump their insurance. They send their employees into the exchange. You've got 96,000 Vermonters who you now have to enroll in a plan in a decade. How does that, are you set up to do that?
Yeah, we will be.
Can I?
Yeah, go ahead.
So exactly for that reason, we set up the bill to enable rolling enrollment so that people will be changing into this new insurance product, transitioning to this new insurance product at the same time as they would be renewing anyway their plans. I also want to say a little bit about my committee and about the hard work that my committee did. This is really complicated federal law, and it's easy for members to get turned around, especially when they've had personal illnesses or other issues that take them away from committee. And so despite their own statements, I want to defend my committee for digging really deep into understanding the weeds of the federal law and doing their best to understand. Another thing that I didn't say earlier, but I wish I had, so I'll say now, under this new law, there will be a new predictability for what insurance premiums are going to be in 2014, a predictability that I would challenge anybody to give me for 2013 insurance premiums. 2/3 of Vermonters are going to qualify for refundable tax credits, and those refundable tax credits are going to set their premium rates for themselves and for their families. Predictability in care in affording health insurance is a major step forward. And I think afterward, some of us can walk through the chart and tell you just a few scenarios of just what health insurance is going to cost for people.
Do you know for a fact, right now, Mike, that the inclusion of those credits will result in cheaper products than we have to get otherwise, or is that just that's your best guess based on everything you've been able to gather?
I think that the federal law is fairly clear that individuals buying health insurance through the exchange who are below 400% of federal poverty level, that we have 2012 federal poverty levels now, 2014 federal poverty levels will be somewhat higher. Exactly how much, we don't know that. But we do know the percent of income that they'll be expected to pay on their premiums, and we have charts that people can walk through.
Mike, what is your status? You're saying 2/3 of Vermonters would qualify, but 2/3 of Vermonters are not going to be at the exchange. It's not even close.
So 2/3 of Vermonters are below 400% of the federal poverty level.
So if they were
So
going,
those that come through the exchange as individuals will qualify.
So you can tell, based on the information you have from the feds, you can tell somebody, if you're a family of four and you're at 325% of poverty, this is the maximum you will have to pay for insurance beginning in 2014.
We can tell you that our projection based on the federal law is that, and I'm not going to try and read through this chart right now,
Right.
but we can,
We can
Yes.
tell people today what they're going to be paying for insurance in 2014.
yes, if they meet the guidelines.
One of the things you've got in your handouts today is some case examples, and there's a family of four with a certain income level, and it quantifies what it's going to cost them compared to what they pay today. We've got pretty good numbers on it.
Let me just offer to the press that both Commissioner Kimball and the chair and Robin Lunge and others will stay afterwards to get into the weeds with you on these questions, so that when you leave, you feel like you have it all.
But you can, one last thing, you can make this predictable because you're now basing someone's premium, an individual in the exchange, is based on a percentage of their income,
Exactly.
right? So
It's just like income sensitivity. It's now a part of your income, and you can predict what you will pay. It is not predictable in today's world. It will be under the exchange. It's another benefit of this exchange for Vermonters.
Yeah, changing the subject, the Senate Natural Resources and Energy Committee is working on drafting legislation that would pretty much mimic the one that you vetoed last year. Have you given any new thoughts to the subject of testing of private wells?
Sure. I don't think it mimics the bill I vetoed last year. The bill I vetoed last year mandated that every single rural Vermonter who drills a well has to get it tested for arsenic. There's a cost involved with that for hardworking Vermonters who are struggling to pay their bills. Building a house or drilling a well is expensive. And there's a very teeny percentage of Vermont's water systems that are likely to test high for arsenic. So what all I suggested to the committee is, if you're going to have a mandate, have it apply to the areas of the state where we know there's a high likelihood that you're going to hit arsenic. We have those records. And number two, better yet, use education as the means to help Vermonters understand the benefits of testing their wells. And I think that's the spirit with which the committee is going forward. If they send me a mandate that requires every single rural Vermonter to test their well at a cost of $600 and weeks getting tests back, I expect that I would greet that with the same enthusiasm as I did last year's bill.
The new president of UVM was announced today. What do you think of him, if you have much to say about him? What do you think of his compensation level and the fact he's going to live on the campus house?
I had the honor of meeting with President-elect Sullivan last week in my office. We were sure to draw the curtains, which they should have done up at the President's house yesterday when they were showing him around. And I got to tell you, I think that the board made an extraordinary choice. He's very thoughtful. He listens well. He's very bright. He has a great vision for the university, and he's someone who gets tough things done. And I think that's exactly what the university needs for leadership.
Among the candidates, was he your top choice?
He was the top choice of the nominating committee, and I personally didn't get involved in a nominating committee. I met with the candidate after the nominating committee let me know they thought he was the best choice, and I agreed with them based upon my knowledge. I should tell you that my chief of staff was involved in the selection process, and he advised me as a fellow Minnesotan that they were making the right choice.
What do you think of his $447,000 paycheck?
You know, I have never had a problem with paying the University of Vermont president a competitive salary for running universities. As you know, my complaint was that if you leave under less than happy circumstances, it seems to me that one might reevaluate the package that might have been promised to you when you took the job. In other words, leave unhappy circumstances. The package is awarded to you. Leave on less than happy circumstances, it should be reevaluated. But I don't have any objection to them paying him a competitive salary. My understanding is that President-elect Sullivan has taken a pay cut to take this job.
Governor, with campaigns just around the corner, Senator Brock has said he would use health care as the centerpiece of his campaign to offer a different and what he says is a better option for Vermonters. Would you likewise say that health care is a centerpiece platform?
You know, I love having a 2-year term because if Vermonters don't want me, I'd just soon be the first to know about it. At the same time, I'm working 7 days a week to try to get the work done in the 2 years that Vermonters so graciously gave me to create jobs, economic opportunities for Vermonters. I really feel strongly that campaigns should start on Labor Day, and that's when I'll start campaigning. Until then, I'll defer my focus to the job I was hired to do, which is create jobs and economic opportunities for Vermonters.
So you won't say whether or not health care will be a part of that conversation?
I'm not going to speculate on a campaign until first I've decided whether to run, and secondly, whether Labor Day has come or gone. And I really feel strongly about this. You know, the great thing about Vermont's democracy is that we don't run endless campaigns, that we give our governor the opportunity to really get a few things done. I've been on this job for less than half, slightly more than half of the assignment that was given to me, and we got a lot to do. So I'm really going to focus on that, Susie.
The Senate Agriculture Committee is looking at this idea of having Vermont ID cards for undocumented workers in Vermont's dairy industry. Is that a good idea?
I think it is. I think it is, because I think it would allow for less confusion and better identity of guest workers that are in this state. So I think that the identification cards would make a lot of sense.
Does it come into any kind of conflict with the federal government in that you may have some people here who are in fact are not documented, and yet the state is giving them what presumes to be a legal ID card?
Well, with those particular ID cards, that's really not an issue. Really, all the ID card says is, this is where I live, this is who I am. It doesn't make any reference to whether you're a citizen or not.
They said they'd really like to be able to legally drive. How do you feel about it? A card that would allow them to do that, if not a driver's license?
Well, that's not what this card does. This is simply an ID card. I think that's the place to start.
Governor, on Saturday, Attorney General William Sorrell filed an appeal in the Entergy federal lawsuit. Can you comment on that? And also, for a national audience and for people hearing about this around the country, can you frame the issues that you see in terms of what this means in terms of the larger issues at stake, not only about nuclear power, but other issues?
You know, I support the Attorney General's appeal of the decision. I firmly believe that Judge Murtha's decision is wrong, that it should be overturned by the Second Circuit, and I'm frankly confident that we're going to make some progress there. So I'm going to be a little careful what I say about the specifics of the case. I'll let the Attorney General do that. But as you know, we have an aging nuclear power plant in Windham County that was scheduled to be shut down in March of 2012, and that's what it was designed to run for, and I believe that's when it should be shut down. Obviously, that's not going to happen, so we're going to move as quickly as we can, both with the Public Service Board and with the Second Circuit, to try to get a more satisfactory decision for Vermonters.
Governor, the Senate committee is also looking at possible, what they're calling a flush fee, to generate revenue to help re-engineer some of our rivers and set up new river protection programs, post-Irene and all. It would be, I guess, essentially an additional 2% sales tax on things that go down the drain. Any thoughts on that?
You know, the first I've heard about it is now, so I really am not familiar with that particular idea, but you know how I feel about sales taxes of any kind. I don't like them. They're regressive. They drive business to other states. Our sales tax is high enough. In fact, I would argue it's too high.
With the fee for discharge for Vermont Yankee in the Connecticut River,
that's not a sales tax.
It's not a sales tax.
Just want to make that clear. It's close to New Hampshire, and it's not a sales tax.
Yeah, they could just go to New Hampshire with their water.
Right.
If the plant were sold, should that be subject to a sales tax?
Excuse me?
If Vermont Yankee were sold, should that be something?
Absolutely.
But it's right across from the
The House committee.
They can take it over there and sell it if they wish.
House committees are looking at increasing the fee, and your administration's proposed that, but is there room to negotiate there? Or does it have to be $417,000?
Well, let's, I mean, the facts matter in this case. The fact of the matter is that right now, under Vermont law, larger dischargers pay a lower rate than smaller people that are discharging water into our rivers and lakes. I'm for equity. I believe that if you're going to discharge water into Vermont's waterways, you should pay the same rate regardless of whether you're a deep-pocketed company or a smaller Vermont employer. So all that provision does, that's the suggestion made by A&R, is level the playing field so that in this particular case, Entergy Louisiana doesn't have a special preferential rate. They pay the same rate as everybody else. So we're really bringing equity to them. I can't believe they wouldn't support it.
Is it just coincidence that this is being enforced now, though? They've had these huge discharges going on since the plant was open. Why enforce that now? Well,
first of all, you should know that these particular permit fees come up every 3 years. So this happens to be the year when we reauthorize A&R's fees. And I think it's also worth mentioning that this proposal was made to me way back last fall in a whole package of A&R fees brought to me by my secretary. I really think that if Entergy Louisiana didn't have quite as many lobbyists in this building, it wouldn't be spun as an increase. It would be spun as what it is. The facts are that right now, Entergy Louisiana gets a preferential rate that no other employer gets in Vermont, who's discharging into state waterways. I believe in equity for all people discharging into state waters.
So is it fair to say that the state's been giving them a break then until now?
That's correct.
You said anything about your visit with Vice President Xi? Did you look into his eyes and see his soul, or did you have some sort of a...
You know, I've been in a lot of meetings since I was governor, and one of the most interesting meetings I've been to was the discussion that I was privileged enough to have with Vice President Biden, with the incoming president of China, with 3 other governors, the governor from Illinois, governor from California, and the governor from Hawaii, and 7 Chinese governors. And in a closed-door meeting, I was convinced that this incoming president of China understands America, American culture, and the obstacles that we find to growing jobs and economic opportunities with a major trading partner, that he understands it, that he understands our culture, he understands our people, he understands that we have to tear down the obstacles to trade on both sides, and that we all win if we grow jobs together. And I believe that relationships like that are really dependent upon personal friendships and interaction. And I found Vice President Xi to be charming, open, and willing to talk to Vermont about how we can grow economic opportunities for both Vermont and China. It was a very productive meeting.
Any word on whether the state is going to hire someone else to deliver the argument in the Second Circuit in the Vermont Yankee case? I understand you're...
You know, you're going to have to talk to the Attorney General about arguing the case. I do want to make clear that he is a separately elected constitutional officer. He's doing a great job. I have a lot of confidence in him, but he's going to make those decisions.
Do you think he should
Should what?
hire an outside counsel?
I think that's a decision he should make. I support any decision he makes to win this case.
You said in a previous press conference that you'd remain uncharacteristically quiet on this appeal, and you have. Is that going to continue throughout the entire case?
I'm doing my best.
So should we stop and put our questions?
I would love it. No. Listen, you know, I love the dialogue with all of you. I do have to be a little uncharacteristically circumspect in this one because it's a litigated case, and you might notice that Entergy doesn't spend a lot of time talking about their legal strategy, and we're not going to spend a lot of time talking about ours. All I can tell you is that I'm very optimistic that between the Second Circuit and the Public Service Board, we're going to get a much better outcome than Judge Murtha gave us. And I was very, very disappointed with his decision. I think it was wrong in many ways, and I think that Vermonters have made the right decision in moving forward to right the wrongs of that decision.
Thank you.
Thanks so much.